Quality Assurance Protocol, its implementation at national level. So just to make a joke, the simple job that the Working Group 2 had to do was to transform this into policy guidelines for the European Union. So it was very easy and we had great fun doing it. So that's not the case. So just to say, myself and David will talk about our suggestions around what are currently draft European guidelines for the next 20 minutes or so. But the team involved, you can see in front of you, and it was a great team, and we worked really, really well together. And I've come up with something I think pretty useful so far. So again, just to start by highlighting the fact that our objective, key objective in Working Group 2 was to develop recommendations at the European policy level to ensure high quality, evidence-based and culturally sensitive family support provision. And that idea of recommendations and guidelines for policy at European level would be based on the work that was just described by Lucia and Maria-José at national level, driven by rigorously designed quality assurance protocol. So just to give you a sense of the process, if you look to the top of the graph there, we had the national quality assurance protocols implemented at national level, and we had reports at national level from them. The national level groups then looked at national strengths and recommendations from that process, which were in turn translated into national policy briefs. And our job then was to distill and synthesise all of these national policy briefs into some European policy guidelines. We worked in 3 subgroups. We had a conceptualisation and characterisation of family support group, a group looking at key messages from the National Strengths and Recommendations report, and again the insights and lessons on the quality of family support. And these 3 groups reflected the headings of the national policy briefs. Again, Lucia Maria-José highlighted the countries, 19 countries, and that's the data that we had. And this is where we started. So our byline, our kind of argument is, well, we think that quality family support will be achieved in Europe when these different things happen. So first of all, we talk about having a legislative and policy base. Second, we talk about having a comprehensive approach to services. Third, we talk about intersectoral and interdisciplinary working. Fourth, we emphasise participatory approaches. Fifth, that there is a professional training and education supporting quality family support. And sixth, and critically, the idea of evidence, which has been highlighted already by Maria-José. So these are our overall thematics. This is what is, I suppose, where the major headlines for the policy guidelines and will be developed around. So I'm going to talk about the first 2. David's going to take over then, and then I'll come back at the end. So if we talk about the legislative and policy base, what are we talking about here? Well, again, I mean, we've probably had a consistent message in our presentations about the emphasis on children's rights and family well-being focus. So it's this point of the dual focus, recognising the significance of support to families to achieving the rights of children, but also within this emphasising equity, recognising the idea that children and families have different needs in different places and that they're able to access support. But that's our fundamental start point. What was nice to see, and again the variability was absolutely clear in the national protocols and so on, but it was nice to see that there were examples across the national policy briefs of progress in different types of areas, for example in terms of specifying strategies around parenting and so forth. But again, the need to consolidate the progress that had been made. It's no surprise, and it's the clearest message, and it was evident again in the previous presentation, that one of the strongest messages that we received from people was the need to have a proper resource base for family support. And again, the resources point permeated the presentations so far today. The point about institutional context of support practice mightn't be quite 100% clear as written, but the idea here is that we have to join up the policy system with the practice system. We have to design policies in ways that work at the practice level. and that for the person at the front line, which Maria Jose talked about, how do they experience what they do? Do they see it and do they experience it as valuable? And how are they supported all the way from policy through delivery system to have that experience? Ideally, we're suggesting that the legislation and policy base should be orientated towards prevention and early intervention. We know that prevention and early intervention strategies can be effective and more effective than when problems become established for children and families. And again, not that it's the most important thing, but we do recognise and realise that established problems are more difficult and more costly to work with. So that's our first headline idea, legislation and policy base. The second theme, and again it's possibly a working theme, it doesn't really work language-wise fully, but the idea of being comprehensive. And that encompasses, and again starting at the top of the clock, family diversity. So here we're talking about the recognition for the diversity in family structure and culture. For example, people parenting alone, divorced and separated families, and families from different ethnic and racial backgrounds. So that experience, quality family support, will be achieved when it responds to that diversity, when it's attuned to and able to respond to that diversity effectively. The second point we talk about is the universal and targeted basis of provision. And again, starting with the very simple point that all children and families need support at different points, but that some families have additional needs, and that any system, any provision system has to reflect that idea. In some ways, we can say that some children grow up in particularly adverse situations. For example, unaccompanied migrants, children of parents with addiction, children in homeless families. And perhaps the best test of a quality family support system is one that responds to their needs effectively, that reaches them and meets their needs. What was really clear from the policy briefs at national level was the significance of being accessible at local community service delivery level. So in other words, services need to be where people can access them and use them. And again, not in all cases, but it's often the case that NGOs and families and children recognise and value and find NGOs easier to work with, easier to get to. They're more attractive to them than statutory services. Obviously not in all cases. And again, related to the point about, I suppose, the NGO role, and people who work in NGOs understand this 100%, is the idea that family services, family support services, are often funded on a short-term, precarious basis. And again, a key demand from the policy briefs was the desire for funding to be sustainable. So I'll hand over to David to take the next number of themes.
Thank you. Number 3, intersectoral and interdisciplinary. The first one is holistic and ecosystemic approach. I'm quite glad to hear the word systemic. It's been said a few times. So that's where we are in this new paradigm that we're going to claim here today. The realities of families are often complex and intersectional. An individualized assessment of each case must be ensured, and an intervention with the same characteristics. Intervention with them must be holistic, addressing all aspects needed, which requires a combination of actions from one administration or from several systems. This means a change of paradigm, evolving from the current model, which is fragmented, we work apart, very, very separated, to an intersectoral interdisciplinary approach, which could mean a significant leap forward in the quality of services. Collaboration and coordination between services and professionals from the same or other administrations is one of the main axes to promote this paradigm shift. If we find the way for this to happen, families will have better conditions to function properly, and therefore children will have a better chance of growing up in a healthy way. When we say healthy, healthy in all senses. This will be particularly important for families with the specific needs already mentioned, and vulnerable groups, disability, minorities, etc. Service continuum. Intervention should be one, not a sum of actions that are too often carried out in a disjoint manner. Coordination and collaboration are key for the intervention to be an integrated, as mentioned before, and meaningful action. The result of good intersectoral and interdisciplinary working is a range of services becoming available rather than single and suitable intervention response. Structures, mechanisms, guidance, and protocols. In view of the above, it is necessary to create structures, mechanisms, etc., that enable and stimulate such collaboration and coordination so that this new holistic and ecosystemic paradigm can be developed. In that sense, policy mandates. We need policy mandates. Such a paradigm chief requires that and the development of regulations that establish and enable it. For example, a duty to collaborate among sectors and disciplines. If policy doesn't demand it, collaboration, it won't happen. And the last one in this slide, intervention effectiveness and efficiency. In this way, not only will better results be achieved, and therefore more effective intervention will be developed. In addition, all similar actions that may be carried out by different services or administrations will be visible, thus avoiding duplication. There are many services duplicated in different administrations. So that this model will save resources, material and humans, and consequently it will be a more efficient and less costly model. Oops. Number 4, participatory, needs-led. Interventions should be guided by the needs of each case, starting from family needs, encourages their involvement. When people are given the opportunity to participate, they have a better chance of having their needs met. Rights-based is being mentioned here as well. We emphasize the single value of human rights, and the consequence should be services more attuned to the needs and therefore more effective. On the other hand, families and children have the right to be part of the processes where decisions are made that affect them. So listening to their voices must be more central in family support. We have to hear families and children, all of us in those 3 systems already mentioned. It is beneficial to do so because they actively participate. If they actively participate, they will be involved in the process, and the actions that are put in place will lead to better outcomes. It is not the same to participate as a subject as to participate as an object. It's been mentioned already as well. Interventions are not about families with children. Intervention should be with families and children. It is necessary to evolve towards a more participatory model. It is also more democratic at all levels. Such a participation of children and families should take place at all those levels, very well explained by my colleague Maria José Rodrigo. Practice system, provision system, and evidence system. Builds on strengths and capacities. A consequence of the participatory approach is that it is more likely to identify the strengths and capacities that can be drawn on in intervention or practices towards change. Approaching interventions based on them and the different protective factors families possess is recommended. This is also empowering, which is one of the aims that is usually pursued transversally with all members of families, so that they can achieve full autonomy and can function without support, which is what we want. We are claiming family support, but we want them to work without support, naturally. Number 5, professional and training education. The first satellite there is initial and continuing professional development. I'm going to divide this into initial training. Those training programs must be of high quality. Processes of optimization and improvement of curricula should be put in place. The participation of advisors in those processes is recommended. Initial training should ensure competent and skillful professionals. Family support needs to become a subject, a module in university training, and we need to support to achieve this and to spread it out. Initial training must guarantee cutting-edge knowledge. In that sense, we need more research, because research in the fields must be increased, and more funding as a consequence. And the second part of this first satellite is continuing education and continuing professional development. That should be a reality in all countries. In some of them is a reality, and some of them is not. So the structures for its development must be guaranteed. Professionals must have working conditions that allow such training and professional development to be carried out. It is necessary to stimulate professionals' development and recognize and reward those who do so by promotions, incentives, or other things. We know that continuing education, working conditions, and support systems contribute to better services outcomes, increased professional satisfaction, and retention of social action professionals. But funding and resources must be secure in this regard. Professionals developed the expected competencies in the practice. On too many occasions, training programs, initial and continuing, are completed without ensuring that the person receiving it has acquired the corresponding professional qualities. Here I have to remember or share with everybody the excellent work done by Working Package 4 in our previous project, which was, it's been already mentioned as well, about professional skills. Award to Nevenka Segarak, it's been said already, because she led that really, really excellent report. Rest in peace. Requires supportive organizations. Organizational environment must value training and education. To move forward into that direction, the support of experts already mentioned and specialized organization is recommended. And connecting with the next slide, the analysis and use of evidence-based programs will provide the cutting-edge knowledge demanded. Supports the delivery of evidence-based practices. Those practices will educate professionals in a more systematic, empirical, rigorous, comprehensive, and reliable practice. The last two, deliver on intersectoral and interdisciplinary basis. And this is connected with the slide we saw a few minutes ago. There is a demand for comprehensive training that is less fragmented and therefore more interdisciplinary, enabling intersectorality. A training already in the new holistic and ecosystemic paradigm that is demanded. Connected to ongoing professional reflection, training must be connected to real professional problems. In this sense, instead of merely technical professionals, we need reflective professionals, and that's what we have to train.
So our final thematic is evidence, and I think we can be clear and in our understanding. We see it in different ways, but whatever way we see it and whenever we think about family support, we are always thinking about evidence. The top of the clock there talks about evidence-based programs and practice. So again, just to reiterate, we should be using programs and practice that are underpinned by evidence. It's pretty obvious, it's a pretty clear statement, but again, it's something that doesn't happen as much as it should. But we should also be aware that there are practices and programs out there that people are operating at local level, and we need an evidence system that actually allows those practices to be validated and to support the move from local practice to something that can be described as evidence-based. The next two are related, the idea of quality assurance and monitoring and evaluation. Again, we can see, and sometimes that is missed by the academic system, that the data that's produced at the service level can serve as scientific evidence for the analysis of how services operate and their effectiveness. So again, that quality assurance process that should be there in services to the extent that it can be developed. And we need it if we want services to improve. And relatedly, the broader question of programme monitoring and evaluation, these are not optional extras in family support, and they shouldn't be seen as such. They should be seen as routine and expected aspects of what practice is. Again, and we see obviously some cross-cutting in the themes that we have explained or outlined today, but the idea that evidence often is seen to be, led by expert academics, if you want, but it must be co-produced. If we co-produce evidence with children, young people, parents, practitioners, we do this together, we are going to have better evidence, we are going to have more ethically devised evidence, evidence that reflects the rights of those for whom it's relevant, most of all. And I suppose one of the things we are probably this is a bit niche, but it's a significant point. Family support is, as David says, we're talking about a new paradigm, we're talking about a different way of approaching services and achieving children's rights, but we have to build the field. So one of the things we have to try to do is to create opportunities and supports for young researchers, early career researchers who want to become involved in its development. And finally, the point that we are trying to maybe express in the partnership and in the network that is Eurofamnet is that when you bring universities, when you bring third level institutions and delivery systems, NGOs, statutory bodies together, and when you have formal links to underpin those connections, it's a really good model to actually deliver evidence-based practice that meets the rights and needs of children, young people and families. So just in summary, I mean, again, this is where we are at now. We are hoping to deliver the European policy guidelines probably in November, and we have a bit of work to do yet. But this is where we are at the moment, and these themes are the ones that seem to work most effectively. I think the presentation and maybe our conversation after might allow some movement around them, but that core set of 6 ideas will probably be what they will be. So I'll hand over to David just to finish our presentation.